for the children of these key workers who would otherwise be forced to stay home. And they will also need to look after the most vulnerable children. This will mean that there will, of course, be far fewer children in the schools, and that will help us to slow the spread of the disease. And these measures are crucial to make sure that the, as I say, the critical parts of the economy keep functioning and public services keep functioning. So we're simultaneously asking nurseries and private schools to do the same, and we're providing financial support where it's needed. We're making provisions to supply meals and vouchers for children eligible for free school meals. And where some schools are already doing this, I want to make it clear that we will reimburse the cost. And of course, this does mean that exams will not take place as planned in May and June, though we will make sure that pupils get the qualifications they need and deserve for their academic career. Now, I know that these steps will not be easy for parents or for teachers, and for many parents this will be frustrating, and it will make it harder for them to go out to work. And of course, that's one of the reasons that we haven't wanted to go ahead. And that's why we're now working on further measures to ensure that we support not just businesses, but also individuals and their families to keep our economy going, as Rishi Sunak, the Chancellor, outlined yesterday. I also need to remind parents, as we've already advised, that children should not be left with older grandparents or older relatives who may be particularly vulnerable and fall into some of the vulnerable groups. And I know that's going to be difficult too. And I want to thank families for their sacrifice at this difficult time. And I want to thank the whole country for the efforts that people are making to comply with these measures. I particularly want to thank teachers, head teachers, all the support staff who keep schools going, who are going to be able to make these exceptional arrangements work for the benefit of us all. By looking after the children of key workers, they will be a critical part of our fight back against coronavirus. And as I've said, we will take the right steps at the right time, guided by the science. We believe that the steps we've already taken, together with those I'm announcing today, are already slowing the spread of the disease, but we will not hesitate to go further and faster in the days and weeks ahead. And we will do whatever it takes so that we beat it together. And I'm now going to pass, I think, to Patrick to give an update from SAGE's point of view. Thank you.
Overriding consideration, as always, save lives, protect the most vulnerable people from this illness. The vast majority of people have a mild illness, but some get a very severe illness. The measures that were announced a couple of days ago, we already know are taking effect in terms of behaviour, so we can see that already, that people have actually taken that very seriously and have made a difference, and that's really important to carry on with that. But the thing we must protect in order to achieve those aims of saving lives and protecting people is to make sure that the NHS intensive care capacity and the ventilator capacity is not breached. That's what we need to keep looking at, making sure we do not get to a position where that's breached. As this moves fast, and I alluded to this on Monday, more measures will be needed to make sure that happens. And right from the beginning, we said schools are one of the things you can do, but they're less important than some of the others that have been taken. But we now think we're at a stage where this extra bit is an important measure to make sure we stay under that critical protecting the NHS, ICU and ventilator capacity. So that's the reason for now saying that this should go ahead at this time. It's important to stress, and this is really critical, it's not because schools are dangerous places for children. They're not. Children have a very mild or asymptomatic version of this disease in many cases. So they are at the least at risk It's also not a dangerous place for teachers. The reason for this is because of the effect it can have just to knock down further the transmission, put some delay into the system, put some brakes into the system of the transmission of this disease, to bring it down, to protect those people who might get the much more serious version and end up in intensive care or on a ventilator. So that's the reason. Now is an important time to do it. It's not instead of, and it can't supplement the other measures. The other measures are crucially important, and we all have our part to play to make sure that we make those measures as effective as possible to try to drive this right down and make sure we stay below that critical threshold. Thank you.
Thanks very much, Patrick. Jenny, from your point of view.
So I think nothing very much further to add to those points. Exactly as Patrick has explained, this is not a change in the scientific position which we've always taken forward. It is very much a practical response at a critical time, as both the Prime Minister and Sir Patrick has indicated. But very happy to answer any clinical questions that come shortly.
Okay, excellent. Well, thank you very much, Jenny. Let's go straight to you and for your questions on this. I'm Beth, Rigby, Sky News.
Thank you. Prime Minister, just in terms of further measures, a third of the deaths are now in the capital of London. Buses are still full, the tubes are full, bars are full. London is not listening to your advice. You've shut the schools today. When will we see wider enforcement to shut down London properly? And if I may, just on the antibodies test, after quite difficult days and frightening news, something a bit more encouraging today, you talked about getting closer to an antibodies test to tell us whether people have had the virus. When will it be ready, and what sort of impact could it have? Could it be a game changer in helping us manage this disease and keeping our emergency services running? Thank you.
Yeah, well, Beth, thank you very much. And look, we've always said that we're going to do the right measures at the right time. That's what we've done. And actually, I think a lot of people are making a real heroic effort to comply with the advice that we've given. But as I've said tonight and in the past few days, we keep everything under continuous review, and we will not hesitate to bring forward further and faster measures where we think that is necessary. But on the antibodies.
So 2 types of tests are important. The test to say, have you got the active virus? And that's being rapidly scaled up by Public Health England. And that's crucially important to know who's actively got it at the moment. The second one, as you allude to, is the antibody test, which tells you whether you've had it and whether you've now got antibodies against it. And that's progressing very fast. Public Health England are looking at this today. And they've got a test which they've got in-house that they're going, and we're looking at ways to get a much more widespread version of that out. It is a game changer, and the reason it's a game changer is that it allows you to understand the proportion of the asymptomatic population. Who's had this disease but hasn't had symptoms that are in any way significant. And we don't have that number accurately for anywhere in the world at the moment. So if we can get that number, it starts to really help. And going forward, it's going to be critically important to be able to monitor this disease well, because only by being able to monitor it can we start relaxing measures again, start understanding what the effect of taking things off again at some point is. So this is all part of a critical ability to manage this as an agile way going forward.
Thanks. Jenny, anything to add on the
well,
vaccine?
just to say that I think, exactly as Sir Patrick has said, it is actually not just our health workforce, it's our care workforce as well. And the other measures that we've introduced, particularly to protect the vulnerable, when we have a matched workforce, if you like, where we are clearly aware of their antibody status, whether they have had the disease and are therefore safe to work with our vulnerable group, that increases our opportunities around our interventions.
And everybody can see the immense advantages. The thing about this disease, it's an invisible enemy, and we don't know who's transmitting it. But the great thing about having a test to see whether you've had it or not is suddenly, a green light goes on above your head. You can go back to work in the safe and confident in the knowledge that you're most unlikely to get it again. So from an economic point of view, from a social point of view, as Sir Patrick says, it really could be a game changer. It's important not to to get ahead of ourselves. We're not there yet, but you really can see the potential of that advance, which is, as I say, coming down the track. Let's go to Laura Koonsberg from the BBC.
Thank you very much, Prime Minister. You were very eager to avoid closing schools if you possibly could, but now you have taken that decision. Families will wonder, maybe more than anything else tonight, how long these closures might last.
Sure.
Can you give us any indication? The Scottish Government has suggested maybe 6 months until the summer holidays.
Well,
and to the medics, if I may, you have touched on this, Sir Patrick, but in the simplest, clearest of terms, if schools are to be closed to slow the spread, why are they safe places for any child or any member of staff?
Well, on the duration, Laura, obviously we're going to try to keep it to an absolute minimum, as you can imagine, to keep it, try and get things going again as fast as we can. But our judgment right now is that this is the moment to provide further downward pressure, as I say, on that upwards trajectory of the virus by taking that step for epidemiological reasons alone, whilst doing what we can, as I said, to protect our ability to keep the NHS going by delivering care and education for key workers. We think this is the right moment to do it. I wish I could give you an answer about how long it will be, Laura, but we've got to do it right now.
So two sets of measures. One are about making sure all of us are protected, which is about reducing transmission. Second is about protecting those people most at risk. And this falls into the category of the first. It's about making sure that we stop transmission, reduce transmission, and children are not getting a serious form of this illness. They are very mild, often asymptomatic, and therefore don't have a big risk around each other. They also may not spread it as much. We don't know that yet. We don't know the exact spread of this. It's not like influenza. That seems to be clearer, but we don't know exactly how that works. So this is about a measure to protect all of us. It's not a measure because there's some specific risk to children.
Thanks. Jenny, anything you want to add?
Just to say that obviously the whole approach is to reduce the social contact throughout society, and we have taken the measures which maximise the impact to health and our safety, whilst minimising those to the way that we live. This measure moves that on a small amount, as we've said, but as Sir Patrick said, it is not to do with the safety of the children. It's simply about a background level of the numbers of social contacts that we have.
Thanks. Shahad Khan, ITV.
Prime Minister, you mentioned that exams will now be cancelled. There will be plenty of students who are about and preparing to take their GCSEs and A-levels. Their college, sixth form places, their university places and job offers will be contingent on those exams. What measures are you taking on that? Also, if I may, you mentioned you want to increase the number of tests to 25,000 a day. Will people still need to go to hospital to take those tests, especially if they're not showing symptoms? What do you advise people to do?
Okay, well, Shahad, thanks very, very much. First of all, on exams and on the ambitions, the hopes of students, pupils in our schools, I totally understand people's frustrations, the frustrations of parents who are going to feel now that they have to stay at home. And as I said earlier, we're going to make sure that we look after workers of all kinds. But when it comes to kids and their exam qualifications, we will make sure that they are not impeded, their progress is not impeded as a result of the decisions we're having to take now about their schools. So they will get, we will make sure that in time they get the qualifications they need. I don't want to go in detail about when and how those qualifications will be administered, but it will be done fairly